and be like, I know everything about health insurance and I know what I'm going to do and I know what I'm going to pick. It is to give you an idea of what is out there, things you should consider when looking at health insurance, and preparing you if you're like going into a position where you have health insurance and you just don't understand how it works, or if you are going to need health insurance because you're graduating soon and you're going to have to pick it on your own. Or, we have a lot of international students who get insurance through Mason and they don't know how health insurance works within the US. But so we're going to give like a basic overview. The three big reasons to get us started about why you need health insurance are to stay healthy, to save money, and to protect yourself. And the reason I say this is because when we have here in the United States, like we have expensive health insurance. And because we have expensive health insurance, not health insurance, health costs, excuse me, health insurance allows us to access those services for a lower cost. So that helps us stay healthy because it means that we can access it. It helps us save money because we get discounts, and then it protects yourself. It protects your health from long-term health complications by doing preventative health. And it prevents you from, like, I don't know, if you break your leg and your hospital bill is $7,000, you're likely not going to have to pay that $7,000 bill out of pocket. So you're not getting into this like abundance of medical debt. So there's three reasons. And I really just like to start out with that because I do get the question pretty often of like, why do I need this? Do I really need it? It's just an expense. And I can tell you that like health insurance is a lot cheaper than healthcare without insurance. And so we're going to talk about the different options and how it works and stuff like that. I do want to preface and say that what I'm about to go over is general rules. Every insurance plan, every like insurance program is different. And so nothing that I say here is a definitive. When you are looking at health insurance programs, health insurance plans, you need to be sure that you're checking a summary of benefits to see exactly what your plan lays out, so that you are fully aware of what you are paying for and what services you have. Some of what I say, out in here, when you go and look at a plan somewhere else may not be the case. And that's not because what I'm telling you isn't correct. It's just what I told you was the generalization. And sometimes there are differences in what we really see. But for the most part, there's the generalization. So we're going to start by talking about the health insurance life cycle. And the reason I call it a life cycle is because it starts somewhere and then it resets. And so you have to kind of go all over. And so there's 5 steps. And we're going to walk through what each of those 5 steps kind of entails and covers. So I do want to do real fast, if anyone can just raise their hand with a reaction, like if you have seen these words before: deductible, premium, out-of-pocket max, any of those words. Got a hand up. All righty, no problem. So we're going to go through it. We're going to talk about it. And we'll walk you through the steps of it. Now, I can tell you that the health insurance life cycle is pretty standard. You will pay a premium. You will have to meet a deductible. Although there are some programs that do not require a deductible. But again, this is the standardized part of it. So what is a premium? The premium is the cost that you pay to a health insurance company to now say, I have health insurance. So health insurance plans are paid for with a monthly premium. And that's a set amount that you pay every single month for you to have health insurance coverage. The thing about the premium is that you get access to providers, something we call in-network providers, which means providers who have connected with and created a contract with your insurance company to provide services to you at a discounted cost under the health insurance that you hold. So you get access to this network of providers that accept your insurance plan. That means you get discounted plans, you get, discounted plans, discounted services, and your health insurance at some point will start paying that provider for part of your services. You also get discounted costs on healthcare services. A lot of that is an agreement between the provider and the insurance company, but also because you are paying less money once you get a little further on, that'll also help you get more discounted costs. But in general, there are lower costs because your insurance company and your provider said, hey, we're only going to charge X amount for this. And then you also get access to free health screenings. There's a very comprehensive list of preventative healthcare screenings on the healthcare.gov website, which is our federal government website about health insurance. And that tells you all of these different free screenings you get. And that's from blood pressure to diabetes to specific chronic diseases. And the purpose of that is that when you go for your annual physical every year, you've paid your premium, but you haven't gotten to the point where your insurance starts to pay yet. And we'll talk about that. And so you can still access those screenings, which some of them can be really, really expensive at zero cost to you. And that helps people to catch things sooner, to maintain what's going on. If something is, if the screening is all good, to keep an eye on it. If it's bad, to kind of monitor it as time goes on. And so you get access to that. What you need to know, though, is that the premium doesn't mean that you get free healthcare. Because of how the life cycle works, you first have to reach a specific point before health insurance starts to pay for things. And then you have to reach another point to get to a point where you don't have to pay anything at all. And paying your premium just gives you access to your network discounted costs and those free health screenings. And what it does is that, like, if you have an accident and you have a really high cost, you can meet a deductible so that the rest of those services kind of get paid for, your out-of-pocket max, and the rest of those services get paid for. But all in all, your premium is what you pay to an insurance company to say, I have insurance, gives you access to certain benefits. And it is, your key to health insurance. But just because you paid it, there are more steps in the process of that. If anybody can drop in the chat, it was on the last slide, so super easy one. If you want to try and drop in the chat what that was called, if you remember, I'd love to see it. And so we have 5 major steps. I'll give you guys a second before I bust the second one out, spoil it for anybody. But your first step for health insurance is to pay the premium. And once you pay a premium, then you get to pay your deductible. What is a deductible? Well, I'm so glad you asked. Like I said, I forgot this slide existed. This is, again, just the overview of what your premium gets you. So your deductible is an amount of money that you have to pay out of pocket for health insurance for health services before health insurance starts to pay for some of those costs. So I pay, a $100 premium every month, and I go to my doctor. If my deductible is $300, I have to pay $300 out of my own bank account, out of my own pocket, out of pocket expenses, in order to get to a point where my insurance will start paying for anything. So it's typically a set amount. It varies depending on plan. Like I said, I've seen some with a $0 deductible. I've seen things with a $1,500 deductible if you have a family plan. But this is the minimum amount of money that is going to come out of your pocket every year for health insurance, outside of your premium. And the reason I talk about that is because when we talk about the total cost of health insurance, we'll dive into kind of what that looks like. But so the deductible is just a set amount that you have to meet before insurance pays. When you meet your deductible, health insurance pays for some of those services as long as they're covered, and that coverage is dependent on the plan that you have. And it protects you from those really expensive bills that I was talking about. So if your premium is $300 and you get into an accident and you have a medical bill for $500, you really only have to pay $200. That $200 will be split between you and your health insurance, because you'll pay the $300 for your deductible, and then the rest of it will get split. What is important to kind of talk about is that the premium that you pay every month to have health insurance does not count towards your deductible. So if your deductible is, $200 and you have a $100 premium, paying your premium for 2 months does not count towards your deductible. Not all of the medical services that you get will go towards your deductible either. It has to be something that is covered by your network. So if you pay for something that is, your insurance plan doesn't cover the specific procedure, or they don't have an agreement with that doctor, that cost may not count towards your deductible because it's not covered under your insurance plan. And then meeting your deductible also doesn't give you free healthcare, just like paying the premium doesn't either. However, what it does is, like I've said, it brings you to a point where you now split costs, and this is called cost sharing. And so when we get into cost sharing, we'll talk a little bit about sometimes what that looks like. But if anybody had questions about the premium or deductible before we go on, if you want to drop it in the chat, just so I can make sure that we see it and address it if you have it early. But so far, right, you pay a premium every month to have health insurance, and then you pay out of pocket to reach your deductible. And once you reach your deductible, you start cost sharing. I don't see any questions, so I'm going to move on to the cost sharing piece of things. If I can get my laptop to cooperate with me. Cost sharing is that point in the health insurance life cycle where health insurance starts to pay for a specific amount of your medical bills, and then you pay the other portion of it. This is typically a set amount of money, whether it's a dollar amount, like $25 for a service or $35 for an appointment, or it's a percentage, which could be like your health insurance will pay for 60% of whatever service that you get. And again, that's within each plan. Each plan will, each summary of benefits will explain to you what services have copays, what services have co-insurances. The co-insurance is that percentage, and that copay is that flat dollar amount. This also gives you more protection. It gives you lower costs for things, because instead of you paying $100 for a service, you're now only paying $20. So that means that less money is coming out of your pocket. The important thing to know about out-of-pocket costs when we talk about health insurance is that there's a cap on that too, but it can be hard to meet. And before we move on to that portion, I just wanted to talk about, highlight again with the cost sharing, your insurance company will not cost share something that is not covered under the plan. So if you have I don't know, if you have a broken finger and your insurance will only pay for a plaster cast and they won't pay for a splint. I don't actually know if they do plaster casts on fingers. I couldn't think of something off the top of my head. If you decide to go for that splint, they won't pay anything for it. If you want your insurance to pay for something, it has to be, something that they agree on covering. So if you decide to go with that plaster cast, then your health insurance will pay it. And this is just step 3 in our cycle, so there's still more. But those out-of-pocket costs are what are going to eventually add up to meet your health insurance out-of-pocket maximum. Now, if anybody could guess, I would love to see if anybody knows what finally happens when you hit your out-of-pocket max. And I'll give you a hint. It starts with F and ends with tree. This is that point that everyone kind of thinks sort of happens pretty automatically, but it does take time. We have, once you hit an out-of-pocket max is when you'll start receiving health insurance for free. And so that's in our, so then you'll hit your out-of-pocket max. Again, this slide just really talks about the copay is that set amount that you pay out of pocket, whether it's $25, $35, whatever it is that your insurance provides. The co-insurance is a percentage of a service. And my little graphic over here is just to show that your insurance company tends to pay a lot more than you pay at this point. So your insurance takes about 80% on average of your medical costs, and you only have to cover about 20 of it. So when we have that discounted cost, that's what we get. But every time you pay that 20%, you are contributing to your out-of-pocket maximum. And when you hit your out-of-pocket maximum, which is the limit of money that you can spend like out of your own bank account or cash, that is set by your insurance company. Once you hit this, your health insurance, kicks in to take over 100% of your costs. Excuse me one second. So the really important thing to know is that this resets every year. And you have to be careful with that, because if you want to meet your out-of-pocket max and you don't get a lot of health, services done, you want to make sure you go with a plan that has a lower out-of-pocket max. And again, you can check that in your summary of benefits. But it resets every year. And I am happy to tell you that your deductible does count towards your out-of-pocket expenses. So if your deductible is $200 and your out-of-pocket max is $300, you only have to spend $100 more after hitting your deductible before your health insurance becomes free. Again, making up numbers. I don't know what it looks like for a majority of health insurance plans, but typically that is a shorter lived amount of time where your health insurance is paying for everything. It is very common that a lot of people don't reach that. So when we talk about the total cost of health insurance in a second, we will see kind of how that could differ depending on your utilization of health services. Just like your out-of-pocket max goes to zero, your deductible also goes to zero every year. Your health insurance plan will define a year, whether it is the January to December or whether it's something that we use in nonprofit world, which is July to June. But so it resets every year, and then you continue paying your premium, you meet your deductible again, start cost sharing again, you meet your out-of-pocket max again, you get some free healthcare, and then everything resets. At the end of your insurance year, you will typically make selections to re-enroll in health insurance. And that's where you'll see if there are any updates on the prices that your health insurance is charging you, and then get sometimes the opportunity to pick a new plan. So as far as the health insurance life cycle, I just want to stop and see if there are any questions.
I have a question.
Yes.
So, as an international student, this whole system for me is just mind-blowing. There's so many aspects of it, and I just recently had a situation. So, as an international student, we are required to have the Aetna insurance, health insurance. I guess it's the same insurance for every international student in Mason.
Yep.
So I had a problem with my skin. So I went to a dermatologist, and dermatologist prescribed me two creams. One of them was $200, and another one was $65. So, but they all are for the same thing, to treat the same thing. So for one cream, $200, my insurance company covered 90%. So I paid $10 or something. And for another, I paid the whole amount. They didn't cover that at all. So my question is, how they decide which one and what amount to cover?
I'm not sure. That is something that goes on based on your insurance plan. It could be that that your insurance doesn't pay for that one medication at all. It's just not a covered medication. And so they pay for the other one because they cover that within their summary of benefits and all of these little tiny details, and they don't cover the other. It could be that your deductible was that 90% of the other one. Or, I'm sorry, your deductible was the full price of that one, and then your cost sharing kicked in and they covered 90% of the other one that they covered. So it really just depends plan by plan. And if you actually like, you can find all of the information for how this stuff generally works for each insurance program within the summary of benefits. I think you can actually get that on like I think you get like a website for how to get information about the health insurance that we provide here at Mason for students. And could outline it in there. So if you notice that if you go through it and it says your deductible was $60 and or the deductible was $200 or whatever it was, if that was your $200 cream, then you just hit your entire deductible with that one purchase. And that's completely possible, right? Because when we talk about, like, that's why deductibles kind of exist, so that you hit a certain amount and then after that you are not responsible for all of the costs. So it's probably one of those two things. Did that answer your question?
Yeah, thank you. That's good to know.
Yeah, no. So a lot of students, international or not international, get caught up about health insurance. And it's because health insurance is kind of confusing. There's a lot of steps in it that sometimes doesn't make sense. And so I'm really, thank you for sharing that. Because it is confusing. And so that's why we're here to kind of talk about it and move some of that illusion away from it. But if we had any more questions, I'm going to start talking about some more details for health insurance. So I'll take a quick second and see if there's any other questions. Alrighty. So now we're going to start talking about where to get health insurance, when you can get health insurance, and tips for picking health insurance. When we talk about tips for picking health insurance, I am not really giving you advice and telling you what to do. It's more of just giving you some ideas for thinking about health insurance when you're trying to pick a plan. But first, we're going to talk about where to get health insurance. And there are a couple of, like, there's 5 main ways to do that. And then we'll talk about like when you're eligible and when you're allowed to buy health insurance or enroll in plans. So first, for where to get health insurance, the first thing we have is like through your parents until you're the age, like until you hit 26. The the Affordable Care Act, the ACA, is actually the main legislation that expanded a lot of health insurance. And it is, within ACA came this right to having health insurance until you're at the age of 26, whether that comes from a parent, your employer, your marketplace from the government, or Medicaid, which is a government subsidized program. So the first one is going to be your parents. If you're not an international student, if you have like 2 parents who work and you have a health insurance plan, it's probably from one of them. Again, it doesn't have to be like your mother and father. If you have, like, if you were raised by your grandparents and they provide for you, then they would be from them. But generally it comes from like your parents who like claim you as a dependent. You can also get it from your employer. The really good thing about that is that oftentimes your employer will pay part of your premium. So even though the health insurance plan that you see when you're like looking at plans that your job offers, it will say that the employer covers a specific amount of it. And so you're really only paying a discounted deductible, which is really nice. Again, that is a generalization. It is not true all the time, but some places will do it. And part of that is because your employers get like discounts on big health insurance plans for their company, and it has those different perks. The other place to get health insurance is your school. Marina mentioned that the international students here on campus are required to get the Mason Aetna health insurance. The reason we require them to get that is because the deductible is so low that it's like a protective factor. And so but it's not just for international students. Any student who needs health insurance is welcome to get health insurance through Mason. And you can do that through our open enrollment period, or you can do that if there is an extenuating circumstance, which we'll talk about a little in the next slide. I mentioned the marketplace. The marketplace is, again, it was also created under the ACA. And it basically expanded health insurance to allow more people who may not be able to get insurance through their parents' employer or aren't eligible for Medicaid to get health insurance. There's a federal marketplace, which some states engage in, and other states, like the state of Virginia, has their own state marketplace for health insurance. Ours is called, it's Cover VA. I think if you type coverva.org in your browser, it'll come up. It's on one of my last slides. So if I was wrong on that, just wait until we get there. But it is called Cover VA. And so it has really awesome not awesome, but it has like really awesome like filters, so you can look through kind of what you're looking for, what kind of plan you think you may want, and things like that. The other way that you can get health insurance is Medicaid. Medicaid is a government subsidized health insurance plan for people who are low income. The reason I talk about this is because we have students who are here on campus who maybe they're older than 26, or maybe they, do not have health insurance through any of these other ways, and they make below a specific amount of income every year. And so instead of having to pay a premium through the marketplace, they get this subsidized through the government. So Medicaid is, it has specific eligibility requirements. You can go onto Medicaid's website and do a quick little survey. It's not a survey, but it's you give some basic information and they tell you whether or not you could be eligible. And then they, provide you with the application materials. These are really the main ways to get health insurance. If you are under the age of 26, you are entitled to health insurance, so you can get it through the marketplace. Your employer, some employers, do not provide health insurance. If you do go and get a job for an employer that does not provide health insurance, or it isn't benefited, or whatever it may be, then you can get it from the marketplace. If you make below a certain amount, then you could go through Medicaid. And then again, we have the one here at Mason. So if you ever, are like, man, I don't know what to do, you can come to Student Health Services and connect with us for health insurance while you look into other things for the future. So this is the main ways that you get health insurance. But now I want to talk about when you can get health insurance. This also throws people off sometimes, because you can't just decide on a random Tuesday that you want to get health insurance. There are specific times and specific circumstances in which you can do so. The first is open enrollment. Open enrollment is a set time once a year. It's like a couple of weeks that it is open, and you can make changes to your plan. You can cancel a plan and get a new one. You can pick a new one if you need one. For the Virginia's marketplace, it is November 1st through January 15th. Actually, right before this presentation started, I got one from HR at Mason that my open enrollment period is opening May 1st, so I can make changes to my health insurance plan if I want to. The reason that we also have these qualifying life events is because sometimes people don't need health insurance between November 1st and January 15th. Sometimes they're employed at that time, and then outside of open enrollment, something may happen. This is called a qualifying life event. And when you have a qualifying life event, you have 60 days following that event to make these changes, whether it is enrolling in new health insurance, adding adding another person onto your insurance, a dependent onto your insurance. The list that I have here is not comprehensive. There are actually a lot of qualifying life events. The reason I talk about this is because, there is a lot of fear of okay, well, if there's only open enrollment, what if I lose my job? Well, you're still able to get health insurance because you lose your job. And if you're not eligible for Medicaid or, whatever it is, you can, Medicaid also has an open enrollment period, but whatever happens, whether you like if you get married outside of that open enrollment thing, out of that open enrollment period, you can still add your spouse onto your insurance. If you adopt a child or have a baby, you can add that child as a dependent onto your insurance outside of this open enrollment. And that exists so that people don't go without healthcare coverage just because something happened in their life. Other things that, are considered qualifying life events is becoming a US citizen, moving to a different state, sometimes even a different zip code. If you have like a family plan and someone under your family plan like passes away, they are, you were able to make those changes so that you're not paying for health insurance for somebody, so that you're not, spending unnecessary money. But, like I said, this list is not exhaustive. Again, all of that information is on the healthcare.gov website. But my point is that there's typically an open enrollment in period, but you should not worry if something happens to your health insurance during that time. Employers have the option to give you, specific health insurance benefits after you've been, terminated from a position. That goes under that like qualifying life event thing. But so these are the two main times that you can get health insurance. When you have a health insurance program and you are on that open enrollment, they will notify you that it's open enrollment again. And one of two things will happen. Either they'll say, if you want everything to stay the same, just ignore this. Or if you want everything to stay the same, you still need to fill it out. And I guess a third one, if you want to make any changes, you need to fill something out and make those changes now. But the idea is that you will be notified when these open and close. So if you have to make arrangements, and if you happen to have a qualifying life event, you only have 60 days to do so. So you can't wait 90 days from getting married and then go back and say, okay, I want to add my spouse onto my health insurance. It has to be done within a specific time frame. Any questions so far about where and when for health insurance? Awesome. So we will go ahead and move on to like tips for picking health insurance. I really want to talk about things you should consider when you're looking at health insurance plans, because I think this will give people a better idea when they go into looking at the different plans laid out in front of them of what they're looking for. Again, this is not an exhaustive list, and I'm not going to go through every single bullet point, but the main things you want to think about are your health needs. Are you relatively healthy? Do you see a lot of specialists? Do you have a chronic disease? And things like that. How often do you get a prescription? Is it every month? Is it just from time to time? That stuff matters. Also, your budget. How much can you afford every month? Would you prefer to pay more upfront in your premium so that you can pay less than a deductible, or pay less out of pocket? Whatever it is, do you want varied cost? Do you want to be able to print it to like set it out every month because you're going to see X, Y, and Z doctors and it's going to cost this much each time? And network versus out of network. If you don't like a doctor that is in network and they don't have another doctor in network, you may have to pay for it to see an out of network provider if your insurance plan does not cover that. Some insurance plans will cover out of network providers. So like a very common one for that is mental health. So even though like your insurance may say like, oh, we don't have any in-network providers for, therapy, but we, can reimburse you for it. That is when they pay for an out of network expense. Or if you find a provider that does not take health insurance at all, it'll do that too. So that is something to consider. Again, like we were talking about with the coverage for certain things, being aware of that. And then also some of your values, like it all kind of plays into the ones that I talked about, but how much do you want to pay? How much do you value your health? Do you need something all the time? Do you need something very infrequently? And things like that. But so when you're thinking about it, something to consider is going to be this total cost of health insurance. And again, I'm going to make up numbers for this, and it's going to vary, of course, but I think this gives a good idea of kind of what it looks like. So the total cost of healthcare ends up amounting to how much you pay every month for your premium times 12 to be your annual premium, your deductible, how much you pay out of pocket for cost sharing, the difference between your out-of-pocket max and your deductible, which is basically how much you spend in cost sharing before you hit that out-of-pocket max, and then how much you pay for any uncovered services. So if you want to see like a chiropractor, your insurance doesn't cover it. If you pay $235 out of pocket for that and they don't reimburse it, that's $235 that you have to add to your total cost of health insurance. We're going to keep it a little more simple with just big numbers. But so say that your annual premium is, your premium that you pay every month is, I don't know how to do that math, didn't divide that by 12. I think it's $880 or something like that. But if your annual premium is $1,000, you pay $1,000 over the year to have health insurance, and your deductible is $2,000. And then you have to pay an additional $1,000 to get your out-of-pocket max. That is a minimum of $4,000 that you are going to be paying towards your health insurance. So if you decide that, if you don't hit your out-of-pocket max, you'll pay a little bit less than that. Or if you decide that you're going to pay for things outside of your plan, out of network, that can add to it. So when you're thinking about healthcare, you want to make sure that you're going with a premium that you want. You want to make sure that the deductible you select is something that is, realistic for you to hit. If you only go to the doctor twice a year and your deductible is, $500, you might not hit that depending what you go to the doctor for twice a year. If it's just free screenings, like you're not going to pay $500 in that year. So thinking of things like that when you're thinking about what health insurance plan do I want, and how much do I want to spend on health insurance and healthcare every year, that's something to consider. Are there any questions about how we got through the total cost of health insurance, excuse me? No? Wonderful. And so again, just keeping in mind that there is a cost of health insurance that you may not think of because you think because of the cycle, you may think of it in different places. It all does add up to the end. And this is just an example, but you can always look back at your, your summary of benefits and see kind of what your minimum may look like. We're going to start talking about plans. The first two I'm going to go not super in depth with, and then the other ones I'm really just going to gloss over. But one of the main ones that you'll probably see is the Health Maintenance Organization, or HMO. Typically with an HMO, you have a lower premium that you pay less every month, or no deductible, and it has less variable out-of-pocket costs, meaning that each time you go to a doctor, you're going to pay X amount of money. It does require you to say, I'm going to see this one primary care provider, and if I want to see a specialist, I have to receive a referral from my PCP, which means if you are having a skin problem and you want to see a dermatologist, you have to get a referral from your primary care doctor, which is a generalist provider, before you can go and see that dermatologist. And it can happen multiple ways. Either that dermatologist won't see you until you have the referral, or they see you and the HMO may not pay it. This typically has a much smaller network of in-network providers, and it doesn't let you see out of network at all. And it may require you to live in a certain area. That's not always the case. A really popular HMO is Kaiser Permanente. Kaiser, you have to pick a primary care provider. You have to get referrals to see specialists. And for some Kaiser plans, you have to be within Northern Virginia. This may be better for you if you want to pay less overall, and you don't need a lot of specialty care. So if you're generally healthy, you really only see a doctor for your annual physical, and when you get a cold or a sinus infection, like an HMO may be really good for you. The other popular health insurance plan is a preferred provider organization, or a PPO. This typically has a higher premium than a health maintenance organization, may also have a higher deductible, more variable out-of-pocket costs, which means that like it may not be a set amount for prescriptions or a set amount for different services. It could depend on other things. But so some freedom that you get and some flexibility that you get with the PPO is that you don't have to pick a primary care provider, and you don't need to get a referral from them to see a dermatologist. So if I have like a rash and I'm like, I just want to go see a dermatologist, if I have a PPO, I can go right ahead and do that. Also, some PPOs will allow you to elect to get out of network coverage, which means if you want to see a doctor who is not in, does not have a contract with your PPO, they will still pay for it. They just pay a little bit less than they would pay for an in-network provider. It doesn't really have the regional limitations either. So it's really good if you value some flexibility and you may need more specialty care, or if you have chronic chronic illnesses or things like that. So again, not the end all be all, but these are two really, really big, health insurance plans you may see. You may also see something called a high deductible health plan. Basically, a high deductible health plan will you pay a really, really low premium every month, but your deductible is also really, really high. So if you are paying $10 a month as your premium, but your deductible is $5,000, if you break your leg and could be $7,000, you get stuck with that $5,000 bill. And so they do offer something called a health savings account, which you can like put money into for your health needs. But we generally like don't recommend HDHPs because of that emergency concept to it. It's a catastrophe plan. It keeps you from spending, $50,000 on health expenses, but you still end up paying a bunch upfront. We also have EPOs, which is an exclusive provider organization, and the point of service, which is kind of like an HMO. They can go either way. Some of them are like an HMO, some of them are like a PPO. These are generalizations because EPOs, like it says on here that they don't require referral, and that they typically don't cover out-of-network costs, but it could just be the other way around, that they do cover out-of-network, but not referrals and specialists. So it really just depends. And that's, again, where you'd want to kind of dive into that summary of benefits and see what your plan covers. I'm not going to go super into depth into these, but I did want to put them out there because sometimes they are really good options for people. And again, like here's that high deductible health plan. I mentioned on here the health savings plan. A lot of health insurances that are not high deductible plans will allow you to do something called a flexible spending account, which is where you put money from your pre-tax income into an account and you can use that towards health. Towards like health expenses. So you can pay your copay with it or whatever. But the thing about those is that you have to use it within the year of your plan. Otherwise, they will get rid of that funding. They'll get rid of the money that's in your account. Sorry about that, guys. This is just a plan. A chart about the common health insurance plans and the plan features. Again, not an exhaustive list. It may be different for some places, for some health insurance plans, but it kind of gives you an idea that PPOs are going to have a really big network. HMOs are going to have smaller networks, and those big picture kind of things that you may want to think about as far as like getting to specialists and seeing people who are not in your network. I've said it multiple times, but your insurance plan, like health insurance, is different for every single plan. This is not universally true, and you should always make sure to read a summary of benefits before picking a plan. If you are picking a plan for a job, you should always chat with HR if you have specific questions. This is just a picture of a health insurance card, so you know what's on it. Sometimes you have to give this information to insurance or to a provider. The back of your card will have insurance will have like phone numbers to your insurance company for if your doctor needs to reach your insurance provider for anything like that. Excuse me, guys, sorry. I was right, it's coverva.gov for the Virginia marketplace if you need that resource. And then if you want a glossary for health insurance terms, healthcare.gov has a really great one. It has a lot of great information about health insurance and a lot of what I cover in here. And it is the federal government's program, so federal government's website, so it has very trustworthy information. That is all I have for you. There is a survey here if you would like to take it, but if there are any questions that you may have about anything that we talked about during the program, you are welcome to unmute your mic or drop it in the chat. So, oh, sorry, I'll leave that up for another second in case someone wanted to grab it, but thank you all so much for coming. And thank you for participating in Money Smart Day.
All right, thank you, Stephanie. I appreciate it. I'm gonna go ahead and stop the recording.